Cardiovascular diseases are the leading cause of death, including stroke and heart attack. While this is concerning, the good news is that making just a few modifications to one's lifestyle can help prevent both stroke and heart attack. So in this video, I will tell you which factors significantly contribute to stroke or heart attack, and for each cause, I will briefly explain what to do to prevent or eliminate it. High blood pressure is the leading factor that significantly contributes to the occurrence of the aforementioned diseases. In fact, 51% of stroke-related deaths are attributed to high systolic blood pressure. According to scientific literature, the risk of stroke increases when systolic and diastolic blood pressure is above 115 and 75 millimeters of mercury, respectively. People whose systolic blood pressure is between 140 and 159 have a 58% higher risk of stroke than those whose systolic blood pressure is below 130. Scientists have shown that reducing systolic blood pressure by 10 units and diastolic blood pressure by 5 units can reduce the risk of stroke by as much as 41%. Hypertension can cause stroke through many mechanisms. For example, increased pressure within the blood vessels and pressure on the endothelium leads to increased permeability of the blood-brain barrier, resulting in localized or multifocal brain edema. Additionally, due to the damage of the endothelium, local thrombosis and accelerated atherosclerotic processes occur, resulting in narrowing and occlusion of the blood vessels. We are dealing with a similar situation when it comes to heart attack. I came across a publication where we can read that, for example, people with systolic blood pressure in the range of 135 to 147 millimeters of mercury have a 37% higher risk of a heart attack. On the other hand, with a pressure above 147 units, the risk of a heart attack is twice as high. Also, in this case, too high pressure causes narrowing and damage to the arteries, resulting in an inadequate flow of blood to the heart. It is also worth knowing that elevated pressure forces our heart to work harder to pump blood to the rest of the body, leading to enlargement of the left ventricle, which directly contributes to the occurrence of a heart attack. When it comes to food products that help regulate blood pressure, the most helpful are beets, chokeberries, dogwoods, hibiscus, garlic, sesame oil, and black cumin oil. High blood pressure, stroke, and heart attack can also be caused by high cholesterol. However, I am not referring to the normal dietary cholesterol or the cholesterol produced in our bodies. Rather, I am referring to cholesterol that has been altered in some way in our bodies, specifically oxidized LDL cholesterol. This altered cholesterol is the main component of atherosclerotic plaques and the driving force behind the progression of atherosclerosis. Studies have shown that people with various cardiovascular diseases, including chronic heart failure, coronary artery disease, hypertension, and ischemic stroke, have elevated levels of oxidized cholesterol. Knowing how this altered cholesterol works, it is likely that it is the cause of these diseases rather than the result. To prevent the oxidation of cholesterol or its unwanted modification, which can occur due to a lack of antioxidants or free radicals with a high level in the body, it is good practice to increase the consumption of fresh vegetables and fruits, limit the consumption of products containing high amounts of sugar, and highly processed foods that are rich in trans fats and saturated fatty acids, such as potato chips, soups, sauces in powder, and confectionery. In addition, it is best to avoid areas with polluted air, reduce or quit smoking, and include physical activity in our daily schedule. A low-grade systemic inflammatory state is an excellent environment for the development of stroke or heart attack. There are many causes of its occurrence, including bacterial, viral, and fungal infections, exposure to air pollutants and tobacco smoke, chronic stress, poor sleep quality, excessive alcohol consumption, obesity, high consumption of low-quality processed red meat, and products high in sugar. To prevent or reduce the ongoing inflammation in the body, in addition to avoiding the aforementioned products, I recommend including ingredients with proven strong anti-inflammatory properties in your diet. These include cherries, blueberries, strawberries, raspberries, avocados, tomatoes, broccoli, black cumin seed oil, evening primrose oil, olive oil, almonds, flaxseed, turmeric, ginger, cinnamon, and fatty fish. When it comes to the causes of stroke and heart attack, it is impossible not to mention obesity and being overweight. Excessive body mass is one of the main factors responsible for these health problems. In 2016, researchers published an extensive study which proved that in adults who are overweight, the incidence of stroke is 36% higher, and in obese people it is as high as 81%. For those who don't know it, I will say that increased body mass and specifically excess fat tissue produces and releases larger amounts of pro-inflammatory substances, leading to a systemic low-grade inflammation. In addition, weight gain is associated with a significant increase in the development of obstructive sleep apnea, which in turn leads to a number of unfavorable changes in our body, which I will talk about later. Furthermore, being overweight promotes an increase in prothrombic compounds, which also participate in the occurrence of stroke. It's worth noting that people with overweight and obesity have around 20% higher risk of heart attack compared to those with a normal body mass. The most important factor here is the fat tissue content in the abdominal area, also known as the waist-to-hip ratio. Experts have noticed that people with an increased value of this indicator have more than 2.5 times higher risk of heart attack. For more information on how to lose belly fat effectively and healthily, please visit my channel. Moreover, chronic stress and living in a constant state of tension can lead to a heart attack or stroke. A team of British scientists have demonstrated that experiencing psychological stress is associated with an increased risk of ischemic stroke by 40% and hemorrhagic stroke by 73%. Of course, stress also contributes to a heart attack. This is partly because the area of the brain known as the amygdala, which is responsible for dealing with stress, sends signals to the bone marrow to produce additional amounts of white blood cells or leukocytes. This in turn leads to an inflammatory state of the arteries. As is already known, prolonged inflammation can lead to a heart attack or stroke. Among the elements of our life that we have influence over and that have significance for the occurrence of a stroke or heart attack, smoking must be mentioned. For example, tobacco smokers have almost twice the risk of developing a stroke, and in relation to a heart attack, the risk is even more significant, being 3 or even 4 times higher than for non-smokers. I must also say that unfortunately even passive smokers, that is non-smokers who are in the presence of people who smoke, are more exposed to a stroke and a heart attack. According to the studies, the risk of these health problems is higher by about 30 to 40%. In my opinion, it is very reasonable to introduce restrictions on smoking in public places, such as bus stops or restaurants, and of course to observe them. In scientific studies, researchers noted that 13% lower value of the heart attack indicator after the first year of the smoking ban in the aforementioned places. Furthermore, after a few years of the ban, the frequency of heart attack decreased even by 50%. The compounds present in cigarettes are responsible for many different effects. To name a few, smoking tobacco increases the level of triglycerides in the blood and creates an environment that is conducive to the damage of LDL cholesterol. Specifically, smoking leads to oxidation or the harmful modification of LDL cholesterol and its deposition in the arterial wall. Additionally, the nicotine present in cigarettes activates the sympathetic nervous system, accelerating the heart rate and increasing the systolic blood pressure. Furthermore, there is a decreased supply of oxygen to the heart muscle, making the heart inefficient. Lastly, the ingredients in cigarettes contribute to the inflammation of the blood vessels and an increase in the concentration of prothrombotic particles. It is important to note that too high level of homocysteine can damage the vascular endothelial cells, have a negative effect on the brain vessels, and contribute to the necrosis of the blood vessel walls. In addition, scientists believe that an excess of homocysteine can disrupt the blood-brain barrier. This is important in the prevention of stroke. In 2020, a comprehensive scientific work appeared which proved that patients with stroke had a higher level of homocysteine in the blood. Of course, these data do not indicate a causal relationship. However, when combined with the fact that another publication noticed that reducing the concentration of homocysteine decreased the number of stroke cases, there may be something to it. I will add that an elevated level of this component may be associated with the development of many other diseases. To reduce the level of homocysteine, it is particularly useful to take high amounts of folic acid, vitamin B6, and B12. Excessively high levels of blood sugar and the associated diabetes are particularly harmful elements of life that are enemies to both our heart and brain. In 2021, a review of 18 scientific studies covering a range of over 2.5 million people was published, in which the authors noted that individuals with elevated fasting glucose levels have a 79% higher risk of stroke. According to the researchers, the optimal fasting blood sugar level that can reduce the risk is between 70 and 100 mg per deciliter. In another study, experts observed that high glucose levels in the blood vessels also increase the risk of a heart attack by 65%. It is important to know that high sugar consumption, increased glucose levels in the blood, and diabetes contribute to the development of cardiovascular diseases in many different ways. This includes causing oxidative stress in the blood vessels, damaging the endothelium that lines them, increasing arterial stiffness, and accelerating the formation of atherosclerotic plaques. On my channel you can find several videos on what to do and what to avoid to deal with elevated sugar levels and diabetes. It may come as a surprise to some of you that the health of our teeth can play a role in both heart attack and stroke. Scientists have repeatedly proven that periodontal diseases contribute to the occurrence of these health problems. Specifically, the presence of periodontal diseases increases the risk of stroke by 63%, and the risk of heart attack can be doubled. The basis of these correlations is the emergence of a systemic inflammatory state in the course of periodontal diseases, which is involved in the occurrence of the aforementioned health problems. This is due to bacterial infection, as bacteria trigger the production of pro-inflammatory substances in our body. Furthermore, researchers have noted the presence of pathogenic bacteria associated with periodontal diseases in the atherosclerotic plaque. On this basis, they concluded that these bacteria can directly promote the formation of atherosclerotic changes. Now I will talk about another relatively unknown cause of stroke and heart attack, meaning obstructive sleep apnea. In short, it is a condition characterized by recurrent episodes of narrowing or closure of the upper airway at the level of the throat, resulting in decreased oxygenation of the blood and numerous awakenings from sleep, although many people are not aware of such awakenings. Symptoms of obstructive sleep apnea include loud and irregular snoring at night, nighttime urination, increased sweating, palpitations, and awakenings with a feeling of breathlessness, which may be accompanied by dryness in the mouth. What's more, untreated obstructive sleep apnea can cause a range of health problems in the cardiovascular system, including an increased risk of hypertension, coronary heart disease, heart failure, and stroke. This is largely due to the decreased availability of oxygen to the heart muscle cells. Additionally, during obstructive sleep apnea, the sympathetic nervous system is stimulated, releasing catecholamines, such as noradrenaline, and increasing blood pressure, which can lead to damage of the blood vessels and ischemia of the brain. As you can see, the most important causes of stroke and heart attack are factors that we can influence. That is, we can prevent them, and if prevention fails, we still have a chance to fight them. In reality, when it comes to preventing a stroke or heart attack, our health is in our own hands. I wish each of you the desire, motivation, determination, and effectiveness to make the necessary changes in our daily life to avoid these diseases. Also, if you would like to learn how to recognize type 2 diabetes at an early stage, which is one of the predisposing factors for a heart attack or stroke, just click on the thumbnail that appears on the screen. That is all from me today. Thank you for your attention, and see you next time.